Welcome to Lesson 6 of our DSM-5-TR series. Today we turn our attention to specific learning disorder, often called SLD, a condition that sits at the heart of educational psychology and clinical practice. Understanding SLD is essential for anyone working in mental health, education, or assessment, because it highlights how a person can have average or even superior intelligence, yet still face persistent, frustrating challenges in acquiring key academic skills. In this lecture, we'll explore SLD from every angle: how it's defined, how we diagnose it, what factors contribute to it, how it develops across the lifespan, and how to distinguish it from other conditions. Let's begin by laying the foundation with the core diagnostic criteria. Diagnostic criteria. The DSM-5-TR defines specific learning disorder as a neurodevelopmental disorder that involves persistent difficulties learning and using academic skills. These difficulties are not due to intellectual disability, lack of education, poor motivation, or sensory problems. They reflect a specific difference in how the brain processes information related to reading, writing, or mathematics. There are 4 key diagnostic criteria labeled A through D. Each must be met for a diagnosis. Criterion A focuses on the learning difficulties themselves. There must be clear, persistent difficulties in learning and using academic skills, as indicated by at least one of the following symptoms. These difficulties must persist for at least 6 months despite targeted intervention. Examples include inaccurate or slow and effortful word reading, difficulty understanding the meaning of what is read, frequent spelling errors, poor written expression, including grammar, punctuation, or clarity, trouble mastering number sense, number facts, or calculation, problems with mathematical reasoning, such as applying concepts or solving word problems. The phrase, "despite targeted intervention," is crucial here. We're not talking about a child who has never received proper instruction. We're talking about someone who struggles even when evidence-based teaching methods have been tried. Criterion B deals with the severity of these difficulties. The academic skills must be substantially and quantifiably below what is expected for the individual's chronological age. They must also significantly interfere with academic performance, occupational functioning, or daily living activities. This is usually confirmed with standardized achievement testing and a comprehensive clinical assessment. Criterion C addresses the onset. The learning difficulties begin during the school-age years, even if they do not become fully evident until later, when academic demands increase. For example, a child might manage in the early grades but begin to struggle significantly once reading comprehension or written expression becomes more complex. Criterion D ensures we are not misattributing the difficulties. They must not be better explained by intellectual disability, uncorrected sensory problems, neurological or mental disorders, psychosocial adversity, language barriers, or inadequate instruction. When all 4 criteria are met, a diagnosis of specific learning disorder can be made. Specifiers and diagnostic codes. SLD is diagnosed as one overarching condition, but we specify the particular area or areas of impairment. These specifiers are vital because they guide interventions and support. They include, with impairment in reading, F81.0, often referred to as dyslexia; with impairment in written expression, F81.81, difficulties with spelling, grammar, punctuation, or organizing written text; with impairment in mathematics, F81.2, sometimes called dyscalculia, involving number sense, calculation, or reasoning. Each diagnosis can also include a severity specifier. Mild. Some difficulties exist in 1 or 2 academic areas, but individuals can compensate with minimal support. Moderate. Marked difficulties require intensive, specialized teaching and ongoing accommodations. Severe. Severe pervasive difficulties affect multiple areas and require individualized, long-term support. These specifiers remind us that SLD is not one size fits all. It's a spectrum, ranging from mild challenges in a single domain to profound multi-area impairments. Associated features. Supporting diagnosis SLD rarely exists in isolation. Many individuals experience secondary emotional and behavioral consequences due to repeated academic struggles. These can include low self-esteem, anxiety about school, demoralization, and avoidance of academic tasks. Over time, repeated failure can shape a student's self-concept, leading them to believe they are not smart, even though intelligence is typically normal or above average. Difficulties with executive functions are also common. This might include trouble with planning, organizing, sustaining attention, or managing time. Skills critical for academic success. Some individuals also have delays in language development, motor coordination issues, or deficits in working memory. Importantly, these features are not required for diagnosis, but they often co-occur and influence how SLD presents in daily life. Prevalence. Specific learning disorder is one of the most prevalent neurodevelopmental disorders. It affects approximately 5% to 15% of school-age children, depending on the population studied and the criteria used. Reading impairments are the most common, affecting roughly 5% to 12% of children. Written expression and mathematics impairments are less common but still significant. Males are diagnosed more often than females, although the gap may reflect referral patterns rather than true prevalence. Boys with learning difficulties are often identified earlier because their struggles may be accompanied by behavioral problems that draw attention. Girls, who may be quieter or more compliant, are sometimes underdiagnosed despite significant challenges. Development in coarse SLD typically emerges during the early school years, when formal instruction in reading, writing, and mathematics begins. Early signs can include difficulty learning letters and sounds, slow and effortful reading, frequent spelling errors, or challenges with number concepts. Without appropriate intervention, these difficulties persist and often become more pronounced as academic demands grow. For example, a child who struggles with decoding words in first grade may face even greater challenges with reading comprehension in later grades. Similarly, early difficulties with number sense can evolve into broader struggles with mathematics. SLD does not go away with age, but individuals often learn strategies to manage their difficulties. Many adults with SLD develop compensatory techniques that allow them to succeed in higher education and the workplace. The key is early identification and targeted intervention. Without them, the disorder can lead to ongoing academic failure, reduced career opportunities, and emotional consequences. Risk and prognostic factors. The causes of SLD are multifactorial, involving both genetic and environmental influences. Genetic factors play a substantial role, with heritability estimates ranging from 50% to 60%. Children with a parent or sibling who has a learning disorder are at significantly increased risk. Neurobiological factors are also implicated. Research shows differences in the structure and function of brain regions involved in reading, language processing, and numerical reasoning. These neurological differences underlie the persistent nature of the disorder. Environmental factors can contribute as well. Premature birth, low birth weight, prenatal exposure to nicotine, and early psychosocial adversity all increase risk. Early language delays are another important predictor. Children who struggle with speech and language in preschool are more likely to develop SLD later on. Culture-related diagnostic issues. Cultural and linguistic factors must always be considered in the diagnostic process. A child learning in a second language, for instance, may initially struggle with reading and writing. But those challenges might reflect language acquisition, not a learning disorder. Similarly, differences in educational opportunity and quality can impact academic achievement. Accurate diagnosis requires culturally sensitive assessment and careful consideration of the individual's linguistic background, educational history, and exposure to instruction. Sex-related diagnostic issues. Specific learning disorder occurs in both males and females, but males are diagnosed more often. As mentioned earlier, this may be partly due to referral bias, since boys with SLD are more likely to exhibit disruptive behavior that leads to evaluation. Girls may be underdiagnosed, especially if they compensate for their difficulties through greater effort or rely on verbal skills to mask reading or writing deficits. Suicide risk. While SLD itself is not directly linked to increased suicide risk, individuals with the disorder are more vulnerable to secondary emotional difficulties such as anxiety, depression, and low self-esteem. These, in turn, can elevate suicide risk, especially if the individual experiences repeated failure, bullying, or lack of support. Addressing emotional well-being alongside academic skills is therefore a crucial part of treatment. Functional consequences. The consequences of SLD can ripple through nearly every aspect of life. In childhood, persistent academic struggles can lead to school avoidance, behavioral problems, and damaged self-confidence. Adolescents may disengage from school altogether, increasing their risk of dropping out. In adulthood, SLD can limit career opportunities, hinder job performance, and even affect daily activities such as managing finances or understanding written instructions. Yet, it is equally important to emphasize that SLD does not define a person's potential. With appropriate interventions, accommodations, and support, individuals with SLD can excel academically and professionally. Many highly successful people, scientists, artists, entrepreneurs, have SLD but have learned to harness their strengths and compensate for their challenges. Differential diagnosis. A careful diagnostic process is essential as several conditions can mimic or overlap with SLD. Intellectual developmental disorder. In this case, academic difficulties are part of a broader cognitive impairment, rather than being specific to reading, writing, or mathematics. Sensory impairments. Uncorrected vision or hearing problems can affect learning but are not SLD. Neurological or motor disorders. These can interfere with reading or writing but have distinct causes. Language disorders. These primarily affect language comprehension or expression, while SLD affects specific academic skills. Attention deficit hyperactivity disorder. ADHD can impair learning due to attention problems, but SLD involves targeted deficits even when attention is adequate. Educational deprivation. Lack of access to adequate instruction must also be ruled out. Distinguishing SLD from these conditions ensures accurate diagnosis and effective intervention. Comorbidity. Specific learning disorder frequently co-occurs with other conditions. ADHD is one of the most common comorbidities, with many individuals meeting criteria for both disorders. Communication disorders, including speech and language impairments, are also frequent. Anxiety and depressive disorders often develop as secondary consequences of ongoing academic struggles. Developmental coordination disorder and tic disorders may also co-occur. Recognizing comorbid conditions is essential, as they can complicate the clinical picture and require integrated treatment approaches. Summary. To summarize, specific learning disorder is a neurodevelopmental condition characterized by persistent difficulties in reading, writing, or mathematics that are significantly below age expectations and interfere with functioning. These difficulties are not explained by intellectual disability, sensory problems, or lack of opportunity, and they typically begin in early childhood. SLD is diagnosed based on standardized testing, clinical assessment, and evidence of persistence despite intervention. It is categorized by specific areas of impairment and severity levels, and its presentation is shaped by genetic, neurobiological, and environmental factors. Although SLD can lead to significant academic and emotional challenges, early diagnosis, targeted interventions, and supportive environments can dramatically improve outcomes. With the right support, individuals with SLD can build meaningful lives and successful careers. Thank you for joining Lesson 6 of our DSM-5-TR series. In our next session, we will continue our exploration of neurodevelopmental disorders and deepen our understanding of how they shape learning, behavior, and mental health across the lifespan.